Janine, can you hear me okay?
Yep, I hear you.
Okay, good.
I show it's 12:58. We'll just give people 2 more minutes to jump on before we get started. Okay, it's 1 o'clock. Welcome everybody to I think it's the 3rd or 4th call we've had with schools. We are recording this and we'll make it available on our website. Again, if anybody has questions, feel free to put them in the chat box and we'll go through the questions during the question and answer period. So feel free to do that at any time. And with that, I'll ask Dr. Morse to hop on and give her her update.
Okay. Well, I figured I'd say hi personally for once. I know I usually don't show my face, but I figure we're spending so much time together, I should actually say hello in person. I did watch last week's talk. I thank everybody for helping out with that. I was off last week and thought I could do the presentation, but we didn't have very good cell signal and I didn't want to get halfway through and have it drop off. So I thank everybody for filling in. When I was watching it, I did jot down the questions that came up, and I know everyone did a pretty good job of answering those questions, but I will just go through and address them briefly to make sure that those are well addressed. And we did put some of those questions and answers within our FAQ document that's online. So basically, I'll just go through a few slides like we have in the past, and then I'll open it up to questions. So let me just, I need to share my screen. Is it okay? So
it's just
first, I just wanted to start with a quote. What's that?
It just now came up. So, yep.
Okay, great. I just wanted to share a quote. The CIDRAP, which is the Center for Infectious Disease Research and Policy based out of the University of Minnesota, has done a few podcasts about going back to school, and their director at the closing of one of his podcasts had just said, you know, we need to be thoughtful, we need to be tolerant, we need to understand in the schools the situation there is one that no one can really answer, and we need to help each other to be strong and help each other to be safe. You know, they gave a very pro in-person school message. Many other experts have, but I know this is very challenging. I know we're all getting bombarded with should we, shouldn't we questions and fear, concerns, but I just wanted to share hopefully somewhat of a positive quote here, just that we all know that there's no one answer here. No one knows what's going to happen. We don't know the future, but we just need to be persistent and helpful and support each other. And just like the last 6 months, we just need to support each other and be ready to pivot and adjust, just like we have through so many other challenges in education and public health. So hopefully that's a little helpful. So just wanted to also share, I think these went out today for District 10. hopefully they've been out to the other 2 districts in the past. If not, we'll make sure to get them sent to you. But just before I did go on vacation, so it'd be almost 2 weeks ago, I did record a video that was about 20 minutes long, that if you wish to use it, you could use it, say, during faculty meetings as you get ready to start school back up again, just to kind of go over certain aspects of things with your faculty. I have them as a Google Drive file and a Dropbox file because they are quite large, and I do have the PowerPoint slides as well. If you have not received those, we would have emailed them to the same mailing lists. You can let us know and we'll resend those. But again, those are things that I wanted to provide. Another school district had requested that, and I figured, you know what, we'll just share them with everybody, and you can feel free to use those. The other thing, just as a reminder, it's through Massachusetts General, so basically like Harvard area. They have a wonderful running review of all the data coming out that applies to schools. A lot of it is just general. It's about masking and face shields and different non-pharmaceutical prevention methods. And they're continuously updating it. So that's that COVID School and Community Resource Library. It is quite long, but they highlight the parts that they've updated. So it is really interesting if you're looking for science and data to help back up the decisions you're making. And I think that's just an important thing for us to have science fueling this rather than, you know, social media or fears. And just a reminder too, there's been a couple main resources. I know last week there were a lot of questions about opening windows on buses and ventilation and things. And a lot of that and many, many other topics were really well addressed in the Schools for Health Risk Reduction Strategies for Reopening Schools, which is about a 60-page document that was in part done by Harvard and by other experts in the field. Really, really excellent guidelines or guidance document, very easy to read. And if you haven't had a chance to look it over, that is posted on all of our websites. And if I just Google Harvard School Guidelines, it probably pops up in my search engine just because I search it so often. But all of those resources and recommendations are really clearly spelled out there, and it's just a great resource if you haven't yet had a chance to look at it or to recommend to your staff. And then the Reopening America Schools, a Public Health Approach, is just another one that is more recent than the Harvard Guide. It gives a good review of the evidence about COVID in students and things like that. So it's another good, relatively short, easy read as well. So just kind of a recap of what evidence and information we have up here. Just a real quick update, and this is being posted on all of our websites as well, most likely under just our general school website. This reference is something that comes out every year and is updated every year, but this just gives good general guidance on how to manage communicable diseases in your schools. It has a nice grid in the back that kind of goes through every different illness and when a child should be out of school and for how long. It is referenced in the toolkit. So if you have somebody that's out with a fever, you know, how long do they need to stay out? They just updated it for this year. It does have sections in it regarding COVID. And so the specific website is here for finding it on the state website. But again, it will also be on our individual health department websites. So the questions that came up last week, I know one was about fans and ventilation. Again, I referenced here the Harvard guide that I just mentioned. So starting on page 31 of that guide, there's information on ventilation. Basically, I put in red here, this was kind of the motto when we were in med school: the solution to pollution is dilution, whether you're flushing a wound or in this situation, bringing in fresh air. So if you bring in fresh air, you're going to dilute out the air that has virus in it. So having a fan, as this mentions here, just recirculating air without bringing in some indoor air is not recommended. If you bring in indoor air, that's what's recommended. If you can't bring in indoor air, if you can filter it, that's an option. So whether it's opening windows in the school, opening windows on the bus. If you open a window and have a fan blowing in from the window, if you have a conditioning unit, you want to turn it so that it brings in outdoor air.
He is IT security.
Oh, can you guys make sure your computers or phones are on mute? That would be great. So that just talks about that more. So again, we just want to bring in fresh indoor air rather than recirculating air that may have virus in it. And if you don't have an option to do that, you can get a HEPA filter. They're relatively inexpensive. You just want to make sure that it has the capacity to service the square footage of that room. So when we're speaking about things, mitigation methods, ventilation really is a lower on the list. You know, we want to work on distancing and masks, hand washing, those things first, but there is a lot of information that's really helpful in this guide. ASHRAE is, I don't ever remember what this stands for, but it's kind of the Association for Heating and Cooling. They have the ultimate guidance on all of this if you really want your maintenance people to get down and dirty with it. So they have an ultimate guide on how to reopen schools and buildings and offices and all of those in terms of COVID. So that is available for you as well. This is a copy and paste from that Harvard resource. This is page 34. So it actually goes through, walks you right through it. So if you have natural ventilation, open the windows, you can put window fans in. If you have mechanical ventilation, you know, talks about making sure that you increase the outdoor air intake. It talks about not recirculating bathroom air into the other rooms. There's a lot of interesting science behind that because there has been COVID virus found in feces, and you don't want aerosols from the bathroom recirculating. So there's some interesting things behind that, but I won't get into all that. But again, that guide has some really good information about ventilation. So if you're interested in that, I really do encourage you to look at that. So books and libraries, this actually, I really like getting these questions because it gets me to learn some new things. So several international and national museum and library organizations have worked together on this program called Reopening Archives, Libraries, and Museums, or the REALM project. So they have gotten through 3 phases of research looking at books and COVID, and there's another phase that's going to finish up soon, but I summarized their research here. They found, and they did some really elaborate, you know, swabbing COVID on things and then re-swabbing and seeing how long COVID survives on these items. So on archival folders, so I'm guessing that's just like file folders, COVID was no longer isolated after 2 days. After 3 days, your hardcover books, softcover books, the plain paper pages inside of a book, plastic book covering, and the hard cases for a DVD no longer had COVID. So they really do discuss that no cleaning product is recommended on a book because it can damage them. So they do recommend to just do a 3-day quarantine in a standard office building, is the conditions they studied it. Books with glossy pages and board books like little children would use. And they looked at the pages in Braille books, seemed to take 4 days of quarantine for that virus to die. Magazine pages still had a trace amount of virus after 4 days, so you may want to go 5 days with those. They looked at flexible plastic storage bags, and the actual DVD itself took 5 days. And then harder plastic containers, plexiglass, cassette tapes, still had virus at 5 days. So they suggest with those, you may be able to actually use a disinfectant wipe or something because quarantine may not be sufficient for those items. So again, we may want to post these slides up just because I know I put a lot of information on here, but that was just really interesting that they actually went to that level of research on this. So basically, take home, I would say if it's a book, you should quarantine it for 3 days. If it's shiny, you should, or it's a board book, quarantine it for 4 days. But do not try to clean books if possible. I know there's a lot of question right now about neck gaiters and mask. The fabric in general, if it's thin and stretchy, it's not going to be a good filter, because if you stretch it, the holes get bigger and it's going to do a worse job filtering out droplets as you breathe or cough. So there was one study in particular that just came out recently. Just as an FYI, if you look at that study, they looked at, I believe, 14 different types of masks. 3 of them, they studied the spray of droplets when 4 different wearers wore those masks. The other 11, they only looked at one person. So, looking at how research is done, that's really not a very good study at all. So, that one person could have been really full of saliva, or, it just could have been a really, not the best study. So take that with a grain of salt as you look at this research. I wouldn't change, make big changes in your policy based on this research, since with the gator in particular, it was one person and one type of gator. So we'll just take that into consideration. This is kind of a busy slide, but these are pictures of the different masks, and these are descriptions of them. And then this is the relative droplet count. They set the fitted N95 mask, which is the best basically you could use in this study, as 0, and then went up from there. So the fleece gator, which is number 11 right here, again, with one person studied, the relative droplet count was up here at the top. This green one is not wearing anything at all, which was studied in 4 people. And then it kind of, drops down from here. So you can certainly look at that study. Again, I would expect any single ply stretchy material to not be very good. I've gotten questions about that over this past week. My recommendation has been, I wouldn't necessarily forbid gaiters. I would encourage people, if they are willing, to fold over the top so that there's a double layer over the nose and mouth. The requirement, the definition of a facial covering per the state of Michigan, is any fabric material that covers the nose and mouth. So it fits your legal obligation for a face covering. I think as hard as it's going to be to get people to wear face coverings as it is, I don't know that it's worth the fight. And again, this is not a very good study. But again, it is not the ideal facial covering already. The ideal facial covering should be 3 layers of material. But to expect you guys to, check everyone's mask at the door and police that is not really reasonable. So, so just a little insight on that study. Regarding playground equipment, I know there are some questions about cleaning that. Really, just routine cleaning is not required on that. To go into that a little bit further, ultraviolet light from the sun actually may have some disinfecting action on playground equipment. If there is shared toys or balls or things like that, you can try and check those out to students and wipe them down between use to disinfect those. And if there are high touch surfaces like the grab bars on slides, things like that, those can be wiped down. But in general, really the most efficient thing to do is to have kids wash their hands when they come in from recess rather than trying to disinfect playground equipment. With rugs, I did get this question during the week as well, prior to watching last week's talk. There really has not been any research done on how long SARS virus can live on soft surfaces like carpet, towels, clothing, things like that. But in general, viruses, as a general rule, and specifically coronaviruses, cannot live anywhere near as long on those types of materials and environments as they can live on hard, smooth surfaces like desktops. That being said, if there is a big concern, if you have younger age kids that frequently spend time on the carpet, you can get squares of carpet, little remnant squares, and assign them to a child. But ultimately, the risk from those type of surfaces versus desktops is much, much lower. And again, one of the easier and more reliable ways would be after carpet time to have kids wash their hands, because it has to get from the carpet into their eyes, nose, or mouth, and that's going to be from their hands touching the carpet to then touching their eyes, nose, or mouth. So that is typically the easiest and most efficient way to handle those types of things. And to just share a resource, the CDC has put up a link within their school section that really does go over a good review of cleaning in the schools and also hand hygiene in the schools. And within that has numerous resources, posters, and links to other resources. So that's just kind of a nice one-stop shop for things. Of note, I know we got in this question quite a bit about, can we have students clean? And I know initially I'd said, yeah, that seems like a great idea. However, on this page in the CDC, in a box on the side, it specifically states that cleaning and disinfection products should not be used by children or near children. So they have officially stated, and I think we've kind of come to that agreement over the several weeks we've spent talking together, that we really shouldn't be having the students helping with cleaning, which is kind of a bummer, but that is officially there on that CDC website. And this is just an update. I think this has occurred since I was last able to talk with you, and I know some discussion about close contacts came up on last week's call. The state of Michigan, so basically like the state health department, has now officially recommended that when we're considering close contacts, we look at those that are within 6 feet of someone with COVID-19 for a cumulative 15 minutes. So not necessarily just 15 minutes at one time, but 15 minutes cumulatively while that individual is contagious. And the CDC has gone on to specify that not only is it within 6 feet for 15 minutes, but if you've provided care for someone who is sick, if you've had direct contact with someone like touching, hugging, kissing, if you've shared, personal items, they say eating and drinking utensils, teenagers, it could be vaping, other personal items. And if someone has directly sneezed or coughed on you, or you've touched their Kleenexes or some other item that might be contaminated by their droplets. There is also some discussion about what defines an outbreak in a school, and that's going through some discussion. One potential definition will be if it's 2 or more cases within the same building within 2 weeks that are not linked in any other way. So they're not teammates together, they're not family members together, they didn't go to the same party together, but basically they have had contact together at the school. If it was, say, kindergartner and a 6th grader that never ever have contact with each other, that may not necessarily define an outbreak. I know one question came up last week about asthma and masking and exemptions. I did send letters to all of our primary care providers throughout the 19 counties, and these are 3 resources I did share with them. I also shared with them 2 that were specifically for healthcare providers being asked to provide exemptions. One here is from the Asthma and Allergy Foundation of America, and it talks about people with asthma, how the majority of them tolerate face coverings. Also a good toolkit for children, helping them tolerate facial coverings, and then a printable picture book that you can use for children getting ready to wear masks for school. So just to know that has been shared with our primary care providers. Some don't always look at everything that's mailed to them. Some are, a little different about things than others, but hopefully they'll have meaningful discussions with their patients if they're asking for exemptions for facial coverings. These are also things, if you wish to, put on your website or things to share with parents, you're welcome to do. So just an update on, deciding when we might pursue in-person school versus remote learning. We are getting closer to getting some official guidance that's been agreed upon by local health and state public health, and U of M has helped with this. They've also helped with the My Start map, My Safe map that we've looked at before. So it's guidance, they're not rules. It's still something you can, choose to do things a bit differently, and we can help with those discussions. But that guidance should come out most likely Monday or Tuesday next week. I was fortunate to be able to get a look at that earlier this week and be included on some discussions with that. It is very similar to what we've discussed before. So there won't be anything that's really earth-shattering. It is extremely reasonable. It takes into consideration the community spread of COVID using the MySafe map info data that we've gone over before. I did make a recording showing how to go through that data that is on our website. So if you want to look and see how to use that data and review that data for your county, that is there. It'll look at if there's any recent sudden increases in the community we need to take into consideration. And it will also take into consideration if there's any COVID activity within any of the school buildings. And so based on that information, some of the suggested actions may be to have in-person education with mitigation measures, which is what we've been talking about all along, like spatial distancing and masking and all of those things. A suggestion might be to go to a hybrid model with or without an appropriate pause first. So hybrid might be having some people with remote education so that you can have better spatial distancing. And I think many of the schools likely will have that already, because I know a lot of students and families have already chosen to do remote learning. So you may have smaller classrooms already. Depending on the number of cases in the school, the break could be 3 to 5 days, it could be 14 days. And so all of that will be really clearly defined. If the community COVID activity is extremely high, the next step might be to have elementary students in person, and the higher grades hybrid or remote learning. And then when we get to really, really extreme levels of COVID, if that were to happen again, then we'd go to remote instruction for the entire district. So the grid, again, it's very, very reasonable, very easy to understand. I'm very excited that it's finally coming out. I know it's much later than we would have liked it, but I'm really happy with the results. And again, that should hopefully be coming out to the health departments and the superintendents early next week. So again, it's not rules, it's guidance. And so you can choose to, have a lower threshold for caution, do things a bit differently, but that is finally coming. So we'll have a uniform statewide set of guidance. So it's not, disparate between county lines. I just wanted to share this. This was a new resource that was shared from that Massachusetts General 100-page long collection of data, but this is a really interesting article. It actually, it's in the New York Times, but the data was put together by a statistician that works out of the University of Texas. The data was based on data at the end of July, but basically they looked at the COVID data for every area in the US and predicted what is the risk that you will have a student or staff, someone that will show up at your school with coronavirus during the first week of school, essentially if you were to have started school, basically the beginning of August. So darker is worse. And if you look at the table, if you had a school building with 100 students in it versus 500 students in it versus 1,000 students in it. And I just put New York at the top for comparison, and then Miami-Dade, Florida at the bottom for comparison. They were kind of the best and the worst in the country as comparison. So all of our counties I put here, basically the worst we had is if we had schools of 1,000, which I don't know, and that's an individual building. I don't know that we have many with that big of buildings. But at worst, we may have some counties that could potentially have 3 children or teachers show up with COVID on that first week, which really is not that bad. I know it's more that we'd want 0. We're not going to go a whole school year with 0 COVID cases. But just to look at our state as a whole compared to some other areas in the US, I just think it's, cross our fingers. And in end of July, our numbers were worse than they have been lately. So I just wanted to share this kind of on the end note here. This was an interesting study. And just a reminder that Michigan really has been doing better than many other states. So, all right, with that, I will end it, and I will open it up to questions.
Okay, Dr. Morse, thank you very much. I'm just going to go to the chat now and go up to the first question, and we'll work our way down. Again, if you have questions, feel free to add them in the chat. Once we get to the bottom of the chat, then we'll open it up to people jumping on the call by unmuting yourself, jumping on and asking. So the first question says, here's a scenario. Staff member's daughter tests positive for COVID on a Monday. Staff member gets tested on Wednesday and it's negative. Can the staff member return to work, or does he have to continue to quarantine for the full 14 days?
So, and this is written out in both our toolkit and in the handout. So if you need it in writing for people, it's there. When you are in quarantine, if you've been a close contact to a case, you always have to finish your 14 days. If you get tested and you are negative, there is a high chance it could be a false negative depending on the stage that you're infected. The only meaningful test result, really, if you're a close contact, would be a positive result, because then we know you are for sure infected, and we can track down then any other close contacts you may have. But we'd never use a negative result to get you out of jail free when you're in quarantine. So it's always 14 days. And again, you get tested to see if you're for sure infected, because then we can track down other close contacts. It's never to get you out early.
Okay, thanks, Dr. Morse. Next question. In last week's webinar, it was suggested that windows in the classroom and on buses are open to dilute aerosols. What about keeping classroom doors to the hallways open? Is it the same recommendation?
If you have fresh air coming in, opening the doors does not hurt at all to keep things ventilating. Another recommendation for keeping doors open is so that people do not have to touch the door handles. So that's another reason to keep doors open, unless it's a safety issue, because I know sometimes there's safety recommendations to keep doors shut and locked because of, shooter concerns and things like that. But there are many publications that suggest keeping doors unlocked and open, simply because then that's one less highly touched surface area people don't have to be touching. In terms of ventilation, honestly, it's not going to make a huge impact, but I think the bigger impact there would just be then people don't have to touch the doorknobs.
Okay, next question. I think you've already answered it, Dr. Morse. Should gators be allowed in the schools? Seeing lots of info against them due to them being so thin.
Yeah, and I would just say, every school can make their own decision. I would argue there's also face masks that are really thin. I saw a woman the other day wearing one that had patches of lace on it, and there's a patch of lace right over her nose, so obviously that's not effective. So I think, honestly, getting people to wear a face covering at all is going to be a challenge. And I think it's going to be a challenge for your time to start spot checking everybody's face masks. So I think do what you can do to get people to comply. And if they'll only comply by wearing a neck gaiter, I think it's probably not worth the fight. But again, if you can encourage them to at least fold it, because they're quite long, so there's extra material. If they can fold it over double on that top 4 inches that cover their nose and mouth, that might be easier and better complied with than saying they're not allowed. I know that's kind of a long answer to that question, but I would pick the fights that need fighting rather than trying to make it too much harder on yourselves.
Good suggestion. Next question, what is the recommendation about library books then? Is browsing for a book out of the question? How about classroom libraries?
So I think the big issue is going to be if someone takes them to their home where someone may be ill and having a long period of time contaminating that book. If you have kids that are wearing a mask, hopefully have somewhat clean hands, looking at a book, I honestly don't think the amount of contamination that could occur to that book in that situation is going to be great. When they go home and it's sitting in their home and no one's wearing masks and not washing their hands frequently, that's where it's going to get heavily contaminated. So I would say use within the school, you might want to encourage them to not try to touch everything. But I don't feel like every book that's looked at has to be put into a 3-day quarantine. And, I did not read everything within that website. They had some sample guidelines and recommendations for libraries that I did not read through completely. And so that website may be able to provide you with some, their sample policies for libraries that may help give you some better guidance than that.
Okay, just had a comment on the gaiter next. Says, thanks for the clarification on the gaiter. Hard to believe this study warranted public attention.
Yeah, there's a lot of stuff that warrants some that gets some interesting attention. I know it was brought to my attention, and I know the person who asked this question may be on this call, but someone asked about the safety of infrared thermometers, because apparently that's going on social media right now, the use of infrared thermometers is unsafe. And that led me to look that up, and I just couldn't believe some of the just complete nonsense that's on social media about infrared thermometers. And so it is very challenging to combat just the mistruths and the exaggerations. Again, neck gaiters definitely are not the best face covering, but that study was definitely not the best study either.
Okay, next question. Is there a recommendation for the closing of school at certain heat index? Should this drop since students and staff are wearing masks?
There is no specific guidance for that. Certainly, with wearing a mask, there's concerns if it's extremely hot. You want to make sure that people are hydrating properly, because it is harder to drink fluids if you're wearing a mask. But there's no change in recommendations in terms of activity changes or school closures. But you just want to be mindful that students are able to take the time to hydrate properly. But no, there's not been any changes in terms of school closure guidance. That's something that, again, you certainly have the freedom to make those types of decisions on your own.
Okay. Next question. My district is still intending to keep lunch periods the same. Over 100 kids per lunch period. not enforcing social distancing or doing any sort of cohorting or assigned seating. I don't know what to do. They keep insisting the roadmap crowd size of under 50 only applies to assemblies and not lunches.
Well, they should be distancing them 6 feet apart. And I'd have to pull up the roadmap here to search that out, but I believe if they're in phase 4, then if they are in the cafeteria still, they need to be doing certain things, but I'd have to pull that up to read it. But yeah, that's gonna be, because that obviously times when your masks are off are going to be higher risk times. And so when we're eating, that's a higher risk time. So I would just refer to the roadmap, and I don't want to take up people's time to look it up, but go to the roadmap and see what the requirements are for the cafeteria use. Because I know I copied it and pasted out of there and put that right into our Q&A. But if they're not following that requirement, then that would be a concern.
Okay, next couple of questions are about your presentation and the recording, when they'll be available. Typically, once the recording is done and this call is over, I get the teams will send me the recording, then I need to download it and process it on YouTube, and that sometimes takes a while. So I will do my best to get the recording on the website and available to other health departments to put on their website by the end of the day, but probably tomorrow would be the earliest that the recording will be up there. We'll get the presentation itself up there today, right after this call, and make sure that all 3 health departments have it and have it linked to their website. Next question, please confirm that there is no requirement for an individual to quarantine if they are traveling from out of state. I have had parents ask this.
Yeah, there's no official requirement, and now you just made me remember this was a change. The CDC did change their travel website, their travel recommendations. And I forgot to put this in the slideshow. So now it's not universally recommended that everybody who travels internationally is on quarantine. It's recommended that if they've gone to done a higher risk activity, that they quarantine. And so now you have to kind of look through if their country of travel is in the high risk group. They've also included travel, domestic travel, and if you've gone to a higher risk area, to make sure that when you come back, you distance from people and you wear your mask. It talks about all the things you should normally do, but it never says you have to quarantine. That is something that you as a school can choose to do, but we really still don't have exact requirements to do that. If it is something you're interested in, I can point you to websites that can give you an idea of what states might be higher risk, but it's really difficult, and it changes all the time, and you have to keep up with that. So long story short, it is still not a requirement. Our state has never made that a requirement. The CDC has not made that a requirement. If they know that they had an exposure while they were on the trip, however, then it is a requirement.
Okay, I imagine that'll come up a lot come spring break and holiday season when people are traveling. So, and who knows, guidance may change by then too. So
I was going to say, hopefully by spring break, things are doing better.
Yeah, let's hope. Okay, next question. In the employer screener you provided in the toolkit, it states that employees can return to work if their medical provider clears them prior to the 14-day quarantine. Are you now stating that is false?
Well, I don't recall anything like that being on our employee screener. If they are a close contact, they are on quarantine for 14 days no matter what. So I will look on the employee screener and see if there's a typo in that, but that should not be, they should not be able to be cleared from a quarantine. So I will look at that. I'm assuming it's the appendix in the toolkit. I will look at that and make sure there's not a typo in there.
Okay, the last question we have in the chat box is, do masks need to be worn for indoor gym class at the middle school and high school?
If they're indoors, then I would say yes. I'm not sure what the roadmap says, but if they are indoors, then they should be wearing facial coverings. I'm not sure if the roadmap allows any exception to that, but trying to check that. I just see, kids breathing heavily and within a confined space as a high risk. And so to not wear masks would be a risk. And so I know a lot of discussion has been on having them doing more independent activities like calisthenics or conditioning or other things like that. Sorry, that one got me scratching my head a little bit. If you can get them spaced out sufficiently, that one I'm drawing a blank on, but my answer to that, depending on how crowded that gym is, would be yes.
Okay. What about adults when they are supervising students outdoors?
If they can keep more than 6 feet apart, well, as far as apart as they can, at least 6 feet apart, they could remove them. Really, your best and safest answer is always to have a mask on. I understand we need breaks from them though. So while they're outside, if they can get more than 6 feet away from the children, they can take them off if they need a break. But again, your safest answer to any of those questions are always going to be to have a mask on. So that's why I hesitate to say, with finality, yes, you have my permission to take your mask off, because it's always safest to have the mask on.
Okay, next question. Do you recommend a 14-day quarantine for foreign exchange students?
Again, before the CDC changed their recommendations, that was the recommendation, was anybody coming in from a foreign country needed to be in quarantine for 14 days. Now you are supposed to go to the CDC website and see if their country is one of the high-risk countries. So if you go to the CDC website, if you click on the COVID website, if you scroll down and click on, there should be a tab for travel. Yep, click on travel. If you click on after you travel, and click, there's a tab there for countries with high risk. If they're in one of the level 3 countries, if they're coming in from one of the level 3 countries, they definitely should quarantine for 14 days. You certainly can just require anyone coming in as an exchange student to quarantine for 14 days prior to coming to school.
Okay, next question. An employee was notified that a relative, a daughter-in-law, tested positive. The employee was around a positive person. Who determines if that is a close contact? Should we be reporting all of these to the health department? We are in session with students.
So typically the health department that is investigating the case determines who the close contacts are. So whatever county that sick person lives in would determine who the close contacts are. If there's question about it, we can always try to help figure that out. If you're concerned that they are a close contact, again, we can talk with that individual and determine if they are indeed a close contact. And so I just posted, sorry, I hit enter too quickly. I just posted the CDC website that lists all the countries that require, it lists the countries based on their risk category for COVID, and the level 3 countries are listed at the top. Those are the ones that would require a 14-day quarantine.
Thank you, Dr. Morse. So with regard to the close contacts, again, like Dr. Morse explained, wherever the individual who tested positive lives, that health department in that person's county is going to be the health department that does all the contact tracing.
Well, not exactly. They determine who the close contacts are. They enter them into the system. And then the follow-up goes to the contact's home residence. So let's say someone from Oceana County went to see their daughter in Kent County. The daughter in Kent County is sick. Kent County identifies who the close contacts are. But then the follow-up, the 14-day follow-up for the close contact in Oceana County goes to Oceana County.
Got it. Thanks for that clarification. Hopefully that makes better sense.
Yep. So if Oceana County needs documentation so if someone in Oceana County needs documentation that that individual can be released from quarantine, we can provide that to them. But we wouldn't know about her unless Kent County identified her.
Okay, so next question. If a student becomes symptomatic while at school, are we required to report this to the health department, or is that for a parent to determine and address?
If you have questions or concerns, you can always contact us. However, if they're symptomatic and going to be evaluated for COVID, or we don't know what's going on yet, we typically wouldn't be notified unless we knew for sure it was an actual case for COVID. So you should report confirmed cases to us. So if you find out that that person does indeed have COVID, you should let us know. You do not need to let us know every time or anytime a student has symptoms. However, if there's a really concerning situation, like you have a classroom that has several students who have symptoms and no one's going to get tested, and it's just a really unusual situation that you need our guidance on, you definitely can contact us at any point. But typically, once there's a confirmed case, or someone is really sick and their dad is sick with COVID, or things like that where it's pretty definite it's COVID, that's when you would want to contact us. We may have been contacted already by their healthcare provider, but we'd want to make sure that, you don't want to assume, you want to make sure that we do know about that.
Okay. Does the health department give them documentation that they were a close contact?
We can if it's needed. So we do have a form we can fill out for individuals clearing them from quarantine or stating that they are in quarantine until a certain date, if their employer needs that.
Okay. Many school leaders are struggling explaining how we cannot have in-person Board of Education meetings or social gatherings of 10 or more, but we can bring 1,000 students into a single building.
Yeah, and I struggle too when there's concern about having in-person school, yet we have overnight camps and we have people at water parks and things. And so I know there's just a lot of things that it is hard to explain because of that dichotomy. And I mean, I think technically you could have in-person board meetings, but the safest thing is to not have them. Personally, I don't want to put my foot in my mouth too much, but to me, in-person education is an essential service until it becomes such that we know the harms outweigh the benefits. There are other ways you can have a board meeting that are not as disastrous as not having in-person school. We know that the downfalls of not having in-person school are very great. So I think it's all risk and benefit. To not have in-person board meetings, the replacement for that is pretty equitable compared to not having in-person school. The trade-offs for that are not equitable. I know that's very difficult to explain, but I don't know how else to explain it. And I know it's a very touchy situation, and I know there's just a lot of unknowns and a lot of fear, and we all have that. And so I don't want to minimize anyone's concerns, but we just need to minimize as much risk as we can, but still doing the best service for the people involved. I don't know if that helps or makes sense at all.
Yeah, we had have a couple more statements here regarding that. The State Public Meetings Act does not allow Board of Education meetings in person right now.
Okay.
And then it says, a next one says, not to mention the legislature shuts down for 2 weeks after one of its members tests positive.
Didn't know that one.
And then, thank you, Dr. Morse, essential services. So the fact that schools are considered essential services.
Right, which technically on the list from Homeland Security, it's not. But I mean, really, if we think about it, I think educating our children in the best way possible is essential. And so, again, we had overnight camps this summer, which to me is immensely more risky than having school. But that happened anyway, and we saw outbreaks from those, and didn't really see that much, outcry, I don't think, from parents or anything. But I'm trying not to say something I'll regret here. I think it's just, we know what bad things can happen if we don't teach our children the best way we can teach our children. We don't know what's going to happen until we do it. And if we start having cases and outbreaks and we have to pull back for a while, then we do, but we don't know until we try. So.
Yeah, S. Locke said risk reward. So again, reiterating your risk benefit, risk reward statement. And then Dr. Penny Dora says, Dr. Morse, we appreciate you and all the time you've given us. We know you don't make up the rules, you just enforce them. Thank you for always being available to us.
Well, and the funny thing is we don't enforce a lot of these rules either. We just help give as
Just
much
give
advice
guidance.
as we can. So we really feel for all you guys.
Well, yes, and thank you, all in caps. Is there any other questions? Anybody want to hop on and ask your question? Anything that needs clarifying before we drop off the call? Going once.
Well, real quick, Janine, I'm on the Appendix A, which is the employee screener form, and it states in the past 14 days, have you? And one of them is had close contact with an individual diagnosed with COVID. And then it says, if you answered yes, please do not go into work, self-quarantine at home for 14 days, contact your primary care physician's office if you have symptoms or have had close contact with an individual for evaluation. If you are given a probable diagnosis or test positive, call your local health department to ensure they are aware. But I don't see anywhere where it says your doctor can clear you to come back before 14 days. So if there's any concern or question about that, I'm not sure who asked that question, if they can follow up and let me know. I can go back through the chat too and see who asked.
Yeah, I can do that too. Lots of people are dropping off and you're getting lots of thank yous, Dr. Morse. Great job for your leadership and thoughtful responses. We appreciate all of your help and support. So lots of kudos, Dr. Morse.
Oh, and I know we had talked too about continuing these calls last Thursday. That was brought up, and so I'm happy to keep doing them as long as they're helpful. So, but I know it's 2 o'clock, and so I'm happy to end the call if everybody is, unless anyone has any other questions.
Yeah, we'll send out a new meeting invite for September. These calls are scheduled through the last week of August, and then I'll send out a new invite for going forward. So be looking for that in your email. Just getting lots of thank yous. Please continue the meetings. So we'll just call it a day for now. And again, most likely the recording will be on the website either by this evening or first thing in the morning, and we'll get the presentations up there today. Thank you, everybody.
Thanks, Janine.